What do medical terms on a breast cancer biopsy report mean? If you've recently had a breast biopsy, you might find yourself staring at a report filled with unfamiliar words and abbreviations. It can feel overwhelming, but understanding what these terms mean is key to knowing your diagnosis and treatment options. Remember, always discuss your results with your healthcare team for personalized guidance. Let's explore what these medical terms typically indicate and why they matter. A breast biopsy involves removing a small sample of breast tissue to examine it under a microscope. This helps doctors determine if there are cancer cells and, if so, what kind they are. The biopsy report is like a detailed map showing the nature of the tissue sample. It includes several sections, each providing specific information. The specimen description tells you what kind of tissue was taken, whether it was from a lump seen on imaging or an area of concern. It also describes how the tissue was collected, such as through a needle or during surgery, and notes its size and appearance. This helps pathologists understand what they are examining. The clinical history section shares your medical background and reasons for the biopsy, like previous imaging findings. The gross description describes what the tissue looked like before microscopic analysis, including size, shape, and color. If the tissue was surgically removed, margins might be marked with ink to show if all abnormal tissue was taken out. The microscopic description is where the pathologist looks at the cells closely. Here, you'll see terms like non-invasive carcinoma, which means cancer cells are confined within the milk ducts or lobules and haven't spread beyond. Invasive carcinoma indicates that cancer has broken through these structures and invaded surrounding tissue, which can be more serious. Tumor grade describes how abnormal the cells look and how quickly they might grow, with grades I, Roman II, and triple, indicating low, intermediate, or high grade. Margins refer to whether cancer cells are present at the edges of the removed tissue. Negative margins mean no cancer at the edges, which is a good sign, while positive margins suggest some cancer may still be present. Lymph node status indicates whether cancer has spread to nearby lymph nodes, helping assess the extent of the disease. The final diagnosis summarizes all findings, including the type of cancer, its size, whether it is invasive or non-invasive, and its grade. It also reports on hormone receptor status, such as estrogen and progesterone receptors. If the cancer is hormone receptor positive, it means hormones like estrogen or progesterone are fueling its growth, and hormone-blocking therapies might be effective. HER2 status is another important factor. If the cancer overproduces the HER2 protein, it tends to grow faster but can respond to targeted treatments. Sometimes, additional tests are performed to look for genetic changes or to predict how likely the cancer is to return. These results help guide treatment decisions, but they are usually reported separately from the main pathology report. Understanding your biopsy report helps you and your doctors plan the best course of action. For example, knowing whether the cancer is hormone receptor positive or HER2 positive influences which therapies might work best. Margins tell surgeons if more tissue needs to be removed, and lymph node involvement can determine if additional treatments like chemotherapy or radiation are necessary. It's normal to feel confused by all the medical language. Your healthcare team is there to help interpret these results and answer your questions. Remember, every breast cancer case is unique, and your treatment plan will be tailored to your specific situation. The biopsy report is a vital piece of the puzzle, providing essential information to guide your care. If you have questions about your report, write them down and bring them to your next appointment. Being informed empowers you to participate actively in your health decisions. Always consult your healthcare provider for personalized advice, and trust that, with the right information and support, you can navigate this journey with confidence.